Welcome to this Chemscape presentation on sun safety at work. Skin cancer is the most common type of cancer worldwide, and workers who spend a significant amount of time outdoors are at a higher risk. Constant exposure to the sun's harmful ultraviolet UV rays increases the risk of developing skin cancer. Therefore, it is crucial to take proactive measures to protect yourself. Sun exposure is strongest between 11 a.m. and 3 p.m. and during the summer months. The sun is also stronger at higher elevations and the closer you live to the equator. Sun exposure increases when it bounces off surfaces like water, sand, snow, pavement, or grass. UV radiation absorbs into the skin and is linked to health conditions such as sunburn, premature aging of the skin cancer. Sun exposure is also associated with eye diseases such as cataracts and macular degeneration. You can lower your risk of sun exposure by planning your day with a few simple measures. Check the UV index for your area before you leave for work each day. It gives people an idea of the amount of UV light in their area on a scale from 1 to 11 plus. A higher number means a greater risk of sunburn that could ultimately lead to skin cancer. Seek shade whenever possible and avoid excessive sun exposure. Your employer can provide tents and shade structures to reduce sun and heat exposure if no shade is at your work site. It is also ideal to take breaks inside air-conditioned trailers or rooms to cool down. Schedule the most strenuous work tasks either early in the morning or late in the day outside of the peak of sun and heat exposure. Alternate work and rest breaks to cycle throughout the day. Staying hydrated is equally important for your skin's health. Drinking plenty of water throughout the day helps maintain your skin's moisture levels and reduces the risk of sunburn. Make it a habit to carry a water bottle with you and take regular breaks to rehydrate. The first step in safeguarding your skin is to wear appropriate clothing. Choose loose-fitting clothing like long-sleeve shirts and long pants to cover as much skin as possible. Materials should be breathable fabrics like cotton. Light-colored clothing can also help reflect sun's rays, reducing the amount of UV radiation reaching your skin. You can protect your face, neck, and ears by wearing a wide-brimmed hat. Add UV protective sunglasses to your outfit to shield your eyes from harmful UV rays. Another essential precaution is to apply sunscreen regularly. Choose a broad-spectrum sunscreen with an SPF, sun protection factor, of at least 30. Apply it generously to all exposed skin, including your face, neck, and hands. Remember to reapply every 2 hours, or more frequently if you are sweating heavily. Don't overlook those hard-to-reach areas, such as the back of your neck and ears. Sun exposure and heat exhaustion go hand in hand, so it's important to review the symptoms of heat exhaustion. This includes feeling faint or dizzy, excessive sweating, cool, pale, clammy skin, nausea or vomiting, a rapid, weak pulse, and muscle cramps. As heat exhaustion affects mental alertness, individuals may not realize they are suffering from heat exhaustion. If you observe this in a coworker, it is important to get immediate medical attention before it develops into a serious heat stroke, which is life-threatening. Review first aid procedures for sun and heat overexposure. Treatment includes removing the person from the sun or heat and having them rest in a cool area. Applying cool compresses to lower body temperature and drinking water. A transfer to medical care may be required, especially for heat stroke, which is a medical emergency. Photosensitivity is an extreme sensitivity of the skin and eyes to ultraviolet UV radiation. People may develop skin rashes or burns, even after only limited exposure to the sun. Certain industrial chemicals, prescription drugs, plants, and some essential oils and fragrances can cause photosensitivity. Exposure can happen through skin contact, inhalation of vapors, and fumes affecting the eyes. An administrator can search for photosensitizing substances using a health report and SDS binders. If you take prescription medications, certain ingredients may cause photosensitivity, a chemically induced change in the skin triggered by medication. Check the labels of your medications and contact your pharmacist if you have any questions. It's crucial to be aware of any changes in your skin. Regularly examine your skin for any new moles, growths, or spots that look suspicious. If you notice any changes, such as asymmetry, irregular borders, or changes in color or size, consult a doctor promptly. Early detection is key in successfully treating skin cancer. This ABCDE guide can help you determine if a mole or spot may require further assessment by a doctor. A is for asymmetry. One half is unlike the other half and is not round or oval. B is for border, notched, irregular, or scalloped borders. C is for color, multiple colors, changes in color, or uneven color. D is for diameter, larger than 1/4 inch or a pencil eraser. E is for evolving, change in size, shape, color, or height, new signs and symptoms such as itchiness, tenderness, or bleeding, or non-healing sores. Skincare continues beyond the workplace. Remember, protecting your skin is a lifelong commitment, both on and off the job. Your well-being is important for yourself and for those you love. That concludes our presentation. For specific requirements on workplace sun safety, contact your supervisor.